Black Friday sale, the more you buy, the more you save. Save $100 on every 1,000 you spend. Check out the Summit Firm, only $349.99. And save $50 on our Buena Vista lineup, or get 60 months no interest and free shipping.
Denver Mattress, the easiest way to get the right mattress.
Recently on 3+U, we had a chance to come out to Phoenix Cardiovascular Institute in Fort Oglethorpe, talk with Dr. Dannis Hood. We had such a good conversation. We wanted to come back because, the truth be told, we had just barely touched the surface. So thanks for letting us come back in.
Thank you. Thank you for coming.
We had a tour of the office when we first got here this morning, and it is, as one person has put it, a one-stop shop for your heart health here. People, once they're in your care, you can cover all of it for them.
Right. We want the patient who comes to us with a cardiovascular complaint, whether it is angina, chest pain, palpitations, a possible arrhythmia. We want to be able to screen and evaluate that patient and do everything here so that they're not going all over town and going to different places to get tested. So in other words, exercise stress testing. We also have stress echocardiography, nuclear stress testing, and also Holter monitoring. We also do in-house labs. And so everything that we would need for that patient to find out the cause of their symptoms, we have here. So if we do find something, then and we need further directed care, then we can go ahead and proceed with something more invasive.
You do ask that people come with a referral from their primary care physician. There needs to be some reason for you to have your heart checked out. You were sharing with me, though, something that you're seeing in an awful lot of women, to the point about being able to do all of this in-house.
Yes.
Of a lot of women who kind of are bouncing around with this complaint of chest pain. And there is often an underlying cause, but it's being missed. Is that a fair way to see it?
It is. It is. There is something called microvascular angina. It used to be called Syndrome X years ago. There's a population of women who may have had several arteriograms, and that's the test where we either go into an artery in the arm or in the wrist. Typically, I'll use the wrist or the thumb, and we'll take pictures. They've had that, but the exam was thought to be normal, and so what we're finding is that these women have issues with their microvascular bed. So in other words, the larger arteries are normal, but the problem is in the capillaries and the microvascular system. So there are techniques that we can use involving a small Doppler wire in the catheterization lab, and we do our cardiac catheterizations at Phoenix at Park Ridge Medical Center.
Okay.
And at Park Ridge, we'll go down with a wire into the coronary artery. We'll measure the flow in the artery itself, and then we're able to have an idea of what the microvascular bed is doing as well. It's called coronary flow reserve. We also have a pressure flow reserve wire that looks specifically at the lesion and the behavior of the lesion, the flow across it. And that's a little bit different system. But coronary flow reserve looks at not just the artery, but the vascular bed. We're able to diagnose the problem, and it brings peace of mind, not just to the patient, but it gives us an idea of how to direct care and management.
And it sounds like it's fairly minimally invasive.
It is. It is it's an invasive procedure insofar as it's an outpatient procedure, but access is typically with the wrist or the thumb, and it takes about 15 to 20 minutes to perform. Then they're recovered in a short stay, and then they go home shortly thereafter.
You had told me the first time we were here that there is a connection. We have a lot of type 2 and type 1 diabetics in our area. It's a prevalent complaint, and that it can go hand in hand with heart disease. Is that right?
It does. There's a large number of patients out there who have diabetes, and diabetes not just affects the inner lining of the heart artery, the endothelium. It can accelerate coronary disease. It can accelerate what we call plaque, or the burden of heart disease. And typically, diabetics will not have that early warning system that we hear about, the chest pain or the chest discomfort. It'll be silent angina. So they may be experiencing symptomatic coronary disease and not know it.
You like to educate people.
Yes.
I learn well, but if I can see something, sometimes it sinks in better with me. So in your exam rooms, you have these monitors and you use those as an educational tool. You're not even so much showing your patients their own images as just the general structure of the heart. Is that right?
It's provided by the American Heart. We're fortunate to have those in every room. Not only can we draw cartoons and schematics of what's going on with a particular patient, but we can also show in anatomic detail what's going on with that particular patient according to what disease process they have. And then we can also show videos on that as well. So, for example, if you came in with atrial fibrillation, what is that? That we could, after talking with you, we could show you a video on it.
If you should be a person who needs something like a pacemaker put in, some type of monitoring system, y'all can handle that now remotely, right? Where people can travel and you can still keep a check of their heart health.
We certainly can. And on a normal basis, we do inpatient or we do in-house monitoring every 6 months, and then in between that, on a routine basis, we'll do remote monitoring. And so we also have patients who have to travel, and we can look at their pacers on the road wherever they are.
You only get one heart, so you want to make sure you take good care of it. And I think to hear that your heart health really becomes determined to a degree in your teen years is a really strong statement. So thank you. I feel like my IQ went up a little bit this morning.
Oh,
I appreciate it.
You're
you
welcome.
can reach out. Don't forget, you do need that doctor's referral, but you can ask for one. It's Phoenix Cardiovascular Institute on Battlefield Parkway, and there's their information for you to reach out. Thank you.
All right, thank you.